Okay, welcome everyone to the Innovator's Dilemma. I have Dave Dworschak here from Kamana. Dave, thanks for doing this. Really appreciate it.
Yeah, thanks for chatting with me, Vic. I appreciate it as well.
Yeah. So as you know, this is all about sort of how an innovator looks at the world being, different and interesting compared to the rest of society. So talk about the issue that you saw out there in the health marketplace.
Yeah, sure. So I've got a good friend, John, who's now my co-founder, but he was a nurse for a decade, travel nurse for 5 years, and ultimately it was his pain points of he's a really good nurse, but as a travel nurse, he's moving around very frequently, and that comes with a lot of paperwork, a lot of conversations, a lot of applications. And he found that he's spending just hours, every week or every month, dealing with the same things over and over again, and not able to put the attention into patient care, which is why he ultimately became a nurse. And he felt like he's just spending all of his time on this paperwork that, frankly, should be able to be done one time.
Yeah, interesting. So he was like sort of called to help people as a nurse, but he wasn't super excited about all the paperwork and hours of process that he had to go through.
Yeah, right on the head. Yeah.
And so talk about your personal story. Like, how did you meet John? How did you realize that this was even an issue? Give more of that background.
Yeah, it's interesting. So I've always worked in healthcare as well, but in a very different capacity. Spent a long time building a company that did data migrations for hospital system implementations, and that job was remote. So I would go visit John on some of these travel assignments he was on. He's been a friend of mine since high school, and sitting there in Alaska with him, summer of 2018, just watching how much his phone was ringing. He's having to go find places to print stuff, scan stuff, fax stuff, email stuff. Just watching all of that, and the crazy thing is I would see him spend hours, each week on all of this like paperwork and recruitment efforts, and he wasn't getting a contract. So that got us talking about like, what can we do to solve some of these pain points? And my initial vision was like, hey, John, let me find you some cool tool online to make your life better. And that exploration.
Yeah, like as a technologist, you're like, there must be a solution. I'll just find it for you, and then it'll be done.
100%. Yeah. I mean, I did not go into that research mission intending to start a company, but when I realized how big of a problem there was out there that wasn't being solved, it just got us motivated to take the dive ourselves.
Yeah. Okay. So what was the V1? Like, what was the first attempt that you thought about?
Yeah. So, our first thing was we went out, we started talking to recruiters, we started talking to travel nurses, we started talking to hospitals, and our V1 was really, we're going to implement this cool matching marketplace. It's going to get people connected faster. It's going to get kind of a centralized place to find these connections. And what we realized through that process is it doesn't really matter how fast we're able to make the match. The compliance paperwork and the credentialing after you meet somebody or you meet a recruiter, meet a hospital system for a travel contract, it takes 5 days, 10 days, 20 days. So we realized pretty quickly that we can't work to solve this like speed to match a job perspective if the process after that is still going to take 20 days. So it really shifted our focus to nobody's over here working on this like credentialing and compliance paperwork for nursing and allied health professionals. And I talked a bit about John having to redo all this paperwork all the time, but if you're a hospital system or you're a staffing firm and you're dealing with this for hundreds or thousands of people at once, it's just wildly labor intensive and wildly inefficient. So that V1 shift from
so the matching, the beautiful matching algorithm, it's elegant. Maybe doesn't save as many hours across the market as optimizing and getting the whole streamlining of all the paperwork and accreditation done. So you kind of shifted focus a little bit.
Exactly. I mean, everything is done, highly manual, mostly, emailing, texting. You're sending all these sensitive data across insecure channels. It's not good for the nurse. It's not good for the agency. It's not good for the hospital.
Yeah. Okay. And so talk about the breakthrough moment. Like, do you have a customer you've turned on? Like, are people getting value out of this?
Yeah, for sure. So, we actually first launched what we would call like a digital wallet for nurses and allied professionals. They can use it as a universal profile to store, track, manage, and share their credentials. We launched that now about a year ago, kind of true startup mentality. The minute somebody could basically store and track a license, we just put it out there and got it into the hands of the healthcare community. And about 6-7 months later, towards the end of last year, we launched the first version of our recruitment and compliance software for staffing firms. Right now is our target market. And bringing these healthcare staffing firms a way to efficiently manage all of their credentialing compliance workflows. And from a value perspective, yeah, absolutely. We have now 29 staffing firms on the product, so that most of that growth has come in the last couple of months.
Yeah. So the whole thing was launched a year ago, but at first to nurses. And then you've launched to 29 staffing agencies since Christmas, or since the beginning of the year. Yeah.
Yeah, essentially, yeah.
Yeah. And is it saving them time and effort?
It is, for sure. And on the nurse side, if people go to kamanahealth.com, they make this universal profile. It's really cool because when they go to work with one of our staffing firms that use the other side of our product, it's as easy as I key in my credentials, I authorize my data to be sent, and what typically takes me 5, 10, 15 days gets done in an instant, and I don't have to redo it. So we're getting a lot of value out of that on the nurse side, and starting to see some more of that connection kind of happening in the wild, so to say. Yeah. And then agencies are, that side of the product is a bit younger, where you're talking to staffing firms, hospitals, other healthcare employers, and we've been fortunate to bring on a customer base that's giving us just a lot of feedback and helping us evolve the product.
Yeah, maybe it's younger, but 29 in less than 6 months is pretty fast paced, I think.
Yeah, it is. I mean, we've got a nice, I would say, mom and pop agency base at this point. These contingent healthcare employers range from employing 2 nurses to 2,000 nurses.
Yeah,
so
right.
There's a huge size range, and we're really excited about the growth we've had so far, and really excited about some of the conversations we're in as well.
Okay, then where do you see this going? What's your vision of where it could be in the future?
Yeah, so I mean, our vision from an agent or a travel nursing and travel allied health perspective is, Kamana will be the universal profile that all of these nurses are using to track, store, manage, and share their credentials. And,
as I get accredited to do something else, or I take a class, I put it in the Kamana system, and now everyone has it. So, yeah.
Yeah, absolutely. Yeah. So all the firms you're working with, anyone that's on our employer side of the platform is, that you've authorized into your information, just automatically receives that information. You're being notified of where everything's coming out. And where we really see ourselves is, we are the central profile. And this is starting in the travel nursing space, but I mean, there are 10 million nursing and allied healthcare workers out there that are all managing their stuff practically by carrying around their paperwork in a folder and, walking it up to the educator on the 10th floor of the hospital. And it's just not efficient. So, we do see ourselves as the central driving force of compliance, credentialing, and really HR paperwork if we look at the healthcare staffing space on a broad scale.
Yeah, and then so nurses, but then doctors have a similar requirement, right? So it could expand there as well. I think they have a similar accreditation process.
Yeah, for sure. And, we get asked that a lot because, it would make sense to kind of just go ahead and be more broad. But when you look at the physician, the word credentialing is a little bit more loaded because things are tied to Medicare, Medicaid, insurance validations. But there's a lot of opportunity in that space. And the problem is just as bad, if not worse, from a monetary standpoint.
Yeah. I mean, as you know, I like the idea of you focusing. But as far as a vision for the future, there's plenty of other places that could be more efficient.
100%, yeah. And credentialing and compliance up until this point in time has really always been thought of a back office job for whoever the employer is. And just given the more migratory state of the workforce, and even many nurses, many physicians, many practitioners, they're working at multiple places at once, which means they're redoing the same thing, and multiple people are spending time and effort on the same paperwork, the same tracking, the same processes. So being able to consolidate that into a universal space is just really exciting.
Yeah, great. So if people want to learn more, you mentioned the website, but just give it again, Kamana.com. Is that right?
It's Kamanahealth.com.
Kamana
So Kamanahealth.com.
Spell Kamana, just so people get it.
Sure, yes. Kamana. And for a fun little fact, that effectively in several Southeast Asian languages is slang for where to next. So it's a nice term that ties into the travel healthcare market here.
Right. Well, Dave, thanks for sharing this exciting story. I'm interested to see where it goes from here. Really appreciate it.
We'll see where it goes.
Fun to see it grow. Yeah. Okay. Have a good day. Thanks. Appreciate it.
All right. Thanks so much.